You know, when someone starts losing weight without trying, it's a symptom that has baffled and, frankly, alarmed doctors for centuries. And we're not just talking about your clothes feeling a little bit looser. This is a profound medical mystery where the body seems to just turn on itself. To really get a handle on this, we've got to go way, way back. And I mean way back. Over 2,000 years ago, Hippocrates, the father of medicine, he gave this chillingly accurate description. He recognized that when a body starts to waste away for no apparent reason, it's a sign of something grave, something often fatal. It's a puzzle that is literally as old as medicine itself.
So that really brings us to the core question of this explainer. What is actually happening inside the body when this goes on? Why would the body, when it's already fighting off an illness, begin to basically self-destruct? Well, that's what we're here to figure out.
All right, so first things first, let's get our terms straight. We need to understand what doctors are really talking about when they see this alarming symptom. Because let's be crystal clear, this isn't about diet and exercise. This is a very specific clinical syndrome.
They call it wasting syndrome, or if you want to get technical, cachexia. The key words here are unintentional and significant. We're talking losing more than 5% of your body weight without trying. And crucially, it's not just fat that's disappearing. The body is actively breaking down its own muscle tissue.
So here's the point you really have to remember. Cachexia is almost never the disease itself. Think of it like a giant, flashing warning light on your car's dashboard. It's a signal that something else, something serious, is going wrong deep within the body. Now, to solve this mystery, doctors act a bit like detectives, and they have to start with one critical question. The answer immediately sends them down one of two very different paths, and it helps them tell the difference between simple starvation and something far more chaotic. The question sounds simple, but the answer is this fundamental fork in the road. Is the person eating more, or are they eating less? See, if their appetite is way down, that points to one set of causes. But if they're eating normally or even eating more than usual and still wasting away, that points to something else entirely. And this is where that difference is so critical. During simple starvation, let's say you're just not getting enough calories, your body is smart. It goes into conservation mode. It slows your metabolism way down to preserve precious muscle. But in cachexia, the body does the exact opposite. It kicks into a hypermetabolic state. It's revving its engine and just burning through both fat and muscle without any discretion. And you absolutely cannot fix this by just eating more food. So think of it like this. The body isn't calmly managing a crisis. It's in a state of total chaos. It's a metabolic civil war where its own systems are actively tearing it apart from the inside. Okay, so if the body is in a civil war, what's causing all this chaos? I mean, how does this metabolic self-destruction actually get started in the first place?
It all begins with inflammation. Some underlying disease like a cancer or a chronic infection, it triggers this massive inflammatory response. The body gets flooded with these alarm messenger molecules. These messengers basically hit the big red panic button, sending the metabolism into uncontrollable overdrive and signaling tissues to start breaking themselves down for fuel, even when it's totally unnecessary.
And here are some of the key agitators in this civil war. You've got these inflammatory cytokines like TNF-alpha and IL-6. Those are the powerful alarm signals. But then the disease itself can release its own agents of chaos, like lipid mobilizing factor, which tells fat cells to just release all their energy, and proteolysis inducing factor, which gives a direct order to your muscles, break yourselves down. This whole process is incredibly wasteful. Your body gets trapped in what's called the Cori cycle. It's a futile loop where muscle is broken down, the waste products get sent to the liver to be turned back into energy, which is then sent right back to the tissues. This pointless recycling can burn up to 300 extra calories a day for absolutely no benefit. It's like putting a car in neutral and just flooring the gas pedal. So, now we know how it happens. But what diseases are actually pulling the trigger on this devastating inflammatory cascade? It's time to unmask the main culprits. You might think this is mainly about cancer, and you'd be right that it's the single biggest cause. It accounts for nearly half of all cases. But it is far from the only one. Just look at this.
Psychiatric disorders, GI diseases, chronic infections, they are all significant contributors. It really shows you just how broad the list of potential causes is.
And we drill down, you can see some of the specific examples. Cancers of the lung, pancreas, and stomach are classic culprits here. But so are chronic infections, like TB and HIV. Endocrine disorders, like an overactive thyroid, can just throw the metabolism into overdrive. And even psychiatric conditions, like severe depression or dementia, can have such a profound effect on the body that they lead to this same wasting state.
So finally, let's talk about the impact. Why is recognizing and understanding the syndrome so critically important? Well, the answer is that the stakes for the patient are just immense. Just let this number sink in for a second. 25%. Studies have shown that approximately a quarter of patients who show up at the doctor with significant, unexplained weight loss may die within a year. This isn't just a symptom, it's a powerful predictor of survival. The clinical impact is just devastating. A weakened, wasted body can't tolerate aggressive medical treatments like chemotherapy. It doesn't recover well from surgery. It leads to a catastrophic decline in quality of life. In fact, and this is a staggering statistic, for over 20% of cancer patients, it is the cachexia itself, the wasting, that is the direct cause of death, not the tumor. And this brings us to a really profound shift in thinking. The big question for the future of medicine isn't just how do we fight the disease? It's also this. If the body's own inflammatory response is such a huge part of the problem, can we learn how to calm the storm it creates inside the body itself?